I think overall, Dr. Adnan Qureshi is the leader in this in interventional neurology. I don't know if many people know about that. He's the first interventional neurologist who got trained in the United States, and he's the one that opened the door for all of us to be trained in interventional neurology. Um, Obviously, I mean, he is the one who has been involved in how the training should be done at national level and somewhat internationally also. Um, he wanted me to participate or speak in this presentation mainly because I've been very closely involved with Dr. Jahazeb Liaquat at PEMH in initial training, in follow-up supervision, in monitoring, in discussing all the cases and plan and seeing how he's been performing, and coming up with some requirement of how the program can now be carried out without any international involvement locally in Pakistan. I think at this point, the number of the cases, the volume of the cases, the devices available, the machines that are available, they are at par with United States. I think the level of the training that's is the skill set that's available in Pakistan is at par with United States, and training in Pakistan can be done that's at par with training center in United States. It's important that not everyone can just start doing these procedures. There has to be a very close monitoring of some kind established either at a national level or international level. And at the same time, some kind of like a close monitoring of what cases are being selected, what procedure is being planned, and what is how the complications were managed, and if there were any complications, what can be done to minimize those complications in the future. So Dr. Qureshi already presented the results. I don't think there's anything else for me to add, and I think both myself and Dr. Qureshi can take on any questions at this time. Thank you.
Now, Adnan and Farid, I have a question. We want Pakistani neurologists to learn thrombectomy. And my question is that can they be trained only for thrombectomy, not for the whole interventional neurology? So we don't want them to do aneurysms or AVM, just do left MCA thrombectomy. Can they be trained in 6 months, and can they do it all by themselves if they have done 50 procedures of left MCA thrombectomy, kind of a modified training program for thrombectomy only? Because I think that's kind of the need for the future in Pakistan, that we have more neurologists who are seeing left MCA strokes or large vessel stroke, they can do thrombectomy. So is it possible? And if it's possible, how it can be certifiable or accreditable?
So this is a very interesting question, because 20 years ago, this was the same question being asked in the United States, that perhaps there should be a procedure-based certification. And I think that each country would have to determine what works for them. In United States, I think that the training has been for all procedures, but people have evolved. So there's clearly differences in what people end up doing in their practice. But there's clearly people who are more focused on thrombectomies. There's clearly people who are more focused on aneurysms. So there is actually so far, at least in United States, we haven't been able to come to a place where we can actually just do a training only for a selected group of procedures. And I think a part of it is that when you learn all the procedures, whatever you learn in other procedures, that still helps you with learning the thrombectomy and the procedure that you want to perform in your practice. So I think that we don't have a good formula for how this can happen, but it can happen for sure, because this was a big debate in the United States 20 years ago. And I know that from a practice standpoint, there's clearly a lot of practitioners that were focused on thrombectomy, because as you can guess, that is the largest number of procedures that need treatment, the largest number of patients that will be actually, it will be the largest number of procedures that will see an increase over the next 10 years. So can there be a selective pathway for just thrombectomy and obviously cerebral angiography? I think obviously I can envision that. We haven't had any experience in the United States along those lines, though. Fareed, do you want to add something?
Yes, I think that's an excellent question. It comes at I think at every level. There has been always a kind of like question. Maybe the neurologist should be focused on doing the thrombectomies, and the interventional radiologist focused on doing some other different aspect of interventional neurology. Uh, it is doable, as Dr. Qureshi already mentioned out. There is an element, if you have like 100 or cerebral angiograms you have done, there is an element of procedure skill set. For example, if you are able to provide that trainee with a 50 kind of like a thrombectomies, and in addition to that, there is some kind of other procedures that is scrubbing, because some elements of a procedures are common between all interventional procedures, whether they are doing aneurysm coiling, whether they are doing AVM embolizations, whether they are doing acute stroke treatment or carotid stenting, how they are going to access and engage into the main cerebral vasculature is pretty much the same. What precautions they are going to take, how they are going to use the anticoagulation and antiplatelet therapy or bubble protection or prevention is pretty much the same. So the problem comes is that for the volume of the cases in a number of the amount that in time that you're training them, it's better for them to be scrubbing with all kind of procedures, so they get that basic level of skill set on which then they can then after which specialize into just the thrombectomies. But if you keep them away from the rest of the procedure that are going on in the intervention procedures, they will not be able to achieve that level of skill set, that's all that basic level of skill set for intervention that's needed for thrombectomies. And after that basic level, it may be different for every procedure, but that basic level of how to place the guides in the common carotid artery or internal carotid artery, that's pretty much with every intervention. So it becomes a little challenging to provide that volume of cases if you are limiting them only for intervention. So if you train them with all the procedure first, and then you kind of focus them on intervention, that may be doable.